So Helen, it's nice to see you again.
You too.
You want to talk about your face, is that right, today?
Yeah, that's right.
So tell me what you're thinking.
Well, mainly the concern is like the lines that I'm starting to see between my eyebrows. I feel like it makes me look like I'm angry all the time. They're the main ones that worry me. I mean, I'm not seeing anything around here yet, but I don't know if that's anything that could be prevented.
Okay. And how long have you been worrying about it?
Probably it's become more of a concern over probably the last couple of years, actually. I've been noticing that it's gotten deeper.
Okay. Let me just have a look. Just make a strong frown for me. Okay, now raise your eyebrows right up. Okay, close your eyes tight. Okay, now make a big smile. Yeah. I mean, what I'm seeing is you've got these lines here, and that's from the muscles on the sides of the insides of your eyebrows that are sort of pushing in like this. And they're starting to get more or less permanent, those lines, so they're there when you're not actually frowning now.
Yeah, that's what I've noticed.
The corner of your brows, probably down a little bit. It would probably look a little bit better if it was just a little bit higher there, but around the sides you don't really have any lines here when you smile, so I think that's all pretty good. And your forehead, you're okay with the forehead?
I guess I have been noticing a little bit that there's some more lines coming across.
Okay. You haven't had any treatment for those? You haven't had any muscle relaxing injections or anything?
No, I haven't.
Okay. Well, the treatment that we normally recommend is a muscle relaxing injection. The idea of that is to stop the chronic pulling of those muscles there.
Yeah.
So that's a fairly simple procedure to do, and it just involves a few small injections on either side. And that will weaken those muscles and last for about between 3 and 6 months.
Okay.
I would generally recommend we do that, and maybe we can put just a little bit out the corner of the eyebrow here, just to try and give that a bit of a lift. If you haven't had any of those treatments before, that's all we should do today, just so you get the idea of what they're about. Is that something you'd want to consider today?
Yeah, I think so. It's not really going to make the appearance of my face look any different,
No.
is it?
It'll make you look probably a little bit fresher, and it'll make the skin look a bit smoother.
Right.
You know, it's not going to change your overall appearance, but it'll probably help those problems.
And by maintaining it, it'll stop those lines from becoming like more deep set and permanent.
Yeah. So generally, after you've had the treatments a few times, the time between needing the treatments increases. So usually it would end up about 6 monthly or so, but these treatments aren't permanent. But that's not a bad thing, because we don't want to do something permanent when you've got all these years left of your life. It's actually not such a good idea to try and do something permanent, I don't think. So we can do that treatment today. It's a relatively painless treatment. It's just a few small injections using a very small needle. There can be a little bit of bruising afterwards. Occasionally you can get a headache for a day or so afterwards, but that's pretty uncommon. Okay. And it's best if you don't exercise, at least straight after the treatment, so probably leave it off till tomorrow. The side effects are pretty uncommon. The only one of any note is if some of the muscle relaxing injection gets into the muscle that lifts the eyelid up, you can get a droopy eyelid, but I'll be very careful to try to reduce the risk of that, and it's not something that happens very commonly at all.
Okay.
So should we go ahead and do that today?
Yeah, sounds good.
Okay, Helen, you okay?
Yeah.
Right, what I'd like you to do, this is just a cold stick.
Okay.
Just rub it gently over the areas just between your eyebrows for now. Okay. It'll just cool it down a bit so it makes the needles less stingy. And just roll it backwards and forwards a little bit. Okay, I'm just going to take a little bit of makeup off. Okay, just roll that again. Okay, let me take that one off you for a sec. Okay, now what I'd like you to do is just frown strongly. So now relax. Okay, how's that?
Yeah, it's all right, actually.
Well, that's half of that area done. Now frown again strongly. Relax. Okay, not too bad?
No.
Okay, now just put a finger up there and just push it up away from your eyes. Don't push it downwards. Okay, now the last little bit, I'm just going to rub the eyes there for a sec. And if you can take that in your left hand and just rub it on that left side while I'm doing the right side, you can let go there. So this is the injection which will just lift your brows up a little bit. Okay, swap hands, put a bit of pressure there, and I'll take that ice stick. Is that okay?
Yeah.
Okay, last bit. Okay, that's it. No, it's not too bad. Okay, so just press there, I'll just clean you up a little bit. Okay, well you won't notice anything for a few days, and it normally takes 3-5 days before you'll start noticing anything.
Okay.
And it'll come on slowly over a few days, and you'll probably just find that you won't have any sort of sensation of anything happening, but you'll just find you won't be able to frown quite as strongly. And it gets stronger over about a week or so. And I've just used a fairly standard dose for today because we haven't treated you before. Okay. And then we'll see. Next time we might adjust it if you need to, but that should work quite well for you.
All right.
So the next time I see you, it should be working nicely.
Okay.
Okay, so just take it quietly this afternoon.
Okay.
You can put makeup on, you don't have to do anything special.
All right.
Don't rub around your eyes too much, and best to not go to the gym this afternoon.
All right. And if I do get a headache from it that you said might happen, would I
just take some Panadol,
okay,
and it'll go. It's not very common, but it'll go over a day or so.
All right.
Okay?
Okay.
Any problems, let me know.
All right.
Okay.
Thanks, Dr. Merten.
Hi Helen, it's lovely to meet you. My name's Douglas, and I'm so glad that Dr. Merten has referred you to see me to have your skin treatments done today.
Hi Doug, nice to meet you too.
Hi, my name is Douglas Pereira. I'm the dermal skin therapist at Pure Aesthetics. And over the past 15 years, I've specialised in the prevention, intervention and rejuvenation of the skin's ageing process. Okay Helen, so what we're going to do is just have a little chat about your skin and what your main concerns are. If you can give me your impression of where your skin is at right now and what are the main areas that you'd like to get focus on with today's treatment.
I guess some of the main problems as I see them is that my skin has been oily in the past and I had acne and things like that, so that sort of has left me with some scarring and different kind of skin texture on the surface. There's pigmentation issues from, sun damage and, not wearing sunscreen, things like that.
Okay.
And also I just feel that my skin is quite dull, and doesn't really sort of have much luminosity or anything going on with it. And I'm a little bit concerned, I suppose, about not wanting to, with ageing prematurely.
Okay Helen, so from what you've told me today about your skin, where I'd like to start your treatment plan is a treatment that's called hydrodermabrasion. Have you heard of this before?
I've heard of dermabrasion.
Okay, well it's a very similar treatment. There are a few different versions of dermabrasion. What we'll be doing today for you is the hydrodermabrasion, which there's two parts to the actual treatment. The first one is where we're going to actually use a dry diamond tip, gently sweeping across the face, okay, and this is going to help to slough away dead skin cells, stimulate collagen production, as well as increase blood circulation. Okay, now just those few components alone are going to target a lot of your main concerns, being the pigmentation, the dullness in the skin, as well as a little bit of the thickness due to some of the oiliness that you're experiencing right now. Okay, the second part of the treatment is using the diamond tip again, but the diamond tip now actually has some water flowing through. So this is actually going to come in and draw out any impurities within the skin, just everyday debris on the surface of the skin. So if you think about it, it's a little bit like taking care of a carpet, okay? So we're going to use a vacuum cleaner first to pick up all of the topical debris, like the dry hydrodermabrasion, okay? Then the second part is almost like carpet cleaning. So what we're going to do is we're going to come in and do a wet carpet clean of your skin and draw out any of the stains and impurities that are within. So the end result we're going to get is a far more fresher looking skin, much better elasticity and collagen production, and we should even see a little bit of the pigmentation reduced down after the first course of treatments, and you'll also see the oil flow reduced down a little bit as well. So we should have a more balanced, hydrated and rejuvenated skin.
Okay, great.
Yeah. Now, do you have any concerns or questions regarding the treatment?
I guess just would I be able to go straight back to work? Is my skin going to look red? Does it hurt at all?
Yeah, that's a really good question. A lot of people do ask that. We have our patients that walk straight out of the door and go back to the work, so they come in on their lunch break, which is really great. So there'll be no striping. You know, it's really pain-free and quite gentle to the skin.
Okay, great.
Okay, Helen, so what we're going to do now is we're going to do starting a cleanse on your skin. And from there, I'm going to do a little bit more of a deeper analysis of your skin. And then from there, we're going to actually start performing the treatment.
Okay, great. Thanks, Doug.
Okay, Helen, so we're just going to commence with the diamond tip placed on your chin.